Good afternoon, everyone. Once again, my name is Mark Rivetta. Thanks so much for your patience. We're very excited to see so many of you here join us today. The theme of today's conversation is navigating the world of telehealth. It's a very important topic for everyone, particularly now, during the pandemic and, very soon post-pandemic. And so we want to give you some insights into how to better utilize this service that's becoming more and more critical and more common. I am joined by several fellow presenters, all Byte alumni, Felicia, Dina, and Latika. They will each be talking to you today. So when you see their faces, don't be surprised. It's not just going to be me, fortunately. You're also going to get to meet them and hear from them and learn from them today. As far as what we're going to cover today, there's a couple of topics that are very important that we want to make sure that everyone learns about. First and foremost, what is telehealth, right? When we hear telehealth, it can mean a lot of different things. So we want to make sure that you know specifically what it means. Why use telehealth, right? There's a lot of different benefits and also some pitfalls to telehealth, but still we think that the good outnumbers the bad. And so we want to discuss those options with you. How do I use telehealth? Which of course is just that, right? There's so many different ways to access telehealth, and we want to go over some of the main ones so you can do it successfully. And finally, what happens after a telehealth appointment, right? A lot of people, they don't necessarily see telehealth as a process. They see telehealth more in terms of just I attend the appointment and that's it. But there's actually a lot to do, not just before and during the appointment, but also things that you might need to do after. And so we want to make sure you know exactly what those things are. And finally, like I said, we will have a discussion at the end, a Q&A after all of our presentations. In addition, you are more than free to submit questions in the chat room that we can then discuss. So that being said, let's get started. And I'm going to hand the floor over to Felicia.
Hello, everyone. Hi, good afternoon. Hope you guys are doing well. My name is Felicia Soso, and today I'm going to be talking to you guys about what telehealth is. We're going to learn about telehealth. Um, so our agenda for today is we're going to learn about what is telehealth, why is it important, and the different types of telehealth services. Okay. So first, what is telehealth? So telehealth, also called telemedicine, is basically the use of electronic information and telecommunication to provide medical care without the need to actually visit an office. So medical care in all different ways, but from the comfort of your own home or wherever you are. So we're going to learn why it's necessary and when you're supposed to use telehealth. So basically, it's important one, if you cannot make it to an in-person doctor's appointment, if you physically do not have a car or you just can't, or there's something just going on where you can't make it, but you have a low risk health concern that you can basically ask questions about over the phone or over video chat. And it's also important if you may have symptoms of COVID-19 and you don't necessarily want to go in the office and actually, spread the virus potentially. It's become very popular during this time because, it's easier to do it from home without running the risk of infecting other people. And also, you use telehealth when a doctor wants to monitor you remotely. So that's something that we'll discuss later, but remote monitoring is important with telehealth. And some of the services. So we're going to talk about what necessarily are the services provided with telehealth. And you get virtual appointments, messaging or directly talking with your healthcare provider, remote monitoring, pharmacy prescriptions, vaccine appointments, and health insurance registration. Okay, so now we're going to talk about each one. So virtual appointments are video or phone calls basically hosted by your doctor's office. So you would actually call in and make an appointment. And instead of having to actually go into the office, your healthcare provider will either send you a link to a video chat that you can actually just do from home over your iPad or over your computer. And also they may also call you on the phone instead of doing a face-to-face video chat. And mental and emotional health services are actually often conducted virtually, especially now. You can speak with a therapist or a behavioral health specialist via video or phone call. And now we're going to talk about messaging doctors. So, an important part of telehealth is also you can email, text, message, or talk to your healthcare provider through and get test results through a secure portal messaging system, or also be notified through email or text about your appointment, or even ask questions or express concerns virtually after your appointment without having to go into the office. So now we're going to talk about remote patient monitoring. So with remote patient monitoring, you can actually track vitals from home. So you wouldn't have to go into the doctor's office to do things like get your weight taken, get your blood pressure taken, your heart rate. All of that can be done from the comfort of your home. And actually, when you do remote patient monitoring, typically you don't really, it's not something that you necessarily have to worry about. Your healthcare provider will let you know and give you the equipment to do this from home. So it's basically using specialized technology. This information is recorded, shared with your doctor's office, eliminating the need to go in, and any abnormalities will be tracked and documented, and your doctor will be in contact with you if they see anything that's out of the norm, and then they may ask you to come into the office, but other than that they can monitor you from home. So now pharmacy prescriptions. So as far as pharmacy and telehealth, your doctor can actually send prescriptions directly to your pharmacy without you having to go into the office, or even have it sent to your home. And this is important because if you need a refill or anything of that nature, you don't have to get on the train or get on the bus or try to find somebody to get you a ride. You can actually request it, and they'll have it sent out to you. And you'll either have to go to the pharmacy or they can have it sent to your home. And you can do this all from a secure patient portal as well. Okay, so vaccine appointments. Vaccine Telehealth has become very important during this pandemic. So with vaccine appointments, you can actually schedule these appointments virtually online. Of course, you would have to go in and get the actual vaccine, but as far as scheduling the appointment, all of this can be done virtually. And there's plenty of websites that you can do this on. There's plenty of resources, but two places where you could actually schedule your COVID-19 vaccines or your flu shots are CVS or Walgreens. And then we're going to go over this later, but with this, you just enter your zip code and find the nearest location and enter any information necessary and select the type of vaccine that you'd like, and just schedule a date and time. Okay, so as far as healthcare, this is something that can be done virtually as well. You don't even necessarily need to call in or anything. You can register for your health insurance online. And with this, you just find the right service that you'd want. Do some online insurance shopping, and you can follow the steps on each website and each portal, and you can enter in your information and register for your healthcare insurance online. Okay. So today's activity, we're going to walk through registering for your COVID-19 vaccination. Oh, okay. Let's see. My apologies, the link didn't work, but okay, so here we are. So now we go down. So this is the main, is this the main CVS page? I think it is, yeah. So you go down to get a COVID-19 vaccine right here, and you would click that. And very easy, you go to schedule a COVID-19 vaccine. Oh, okay. You enter your state or territory. Right now, we're in DC. And we check the availability, and it'll tell you, okay, eligibility. Okay, schedule an appointment now. And it'll take you here. So from here, you just basically fill out all of these questions. It's really straightforward. Um, It'll ask you, in the past 14 days, have you been tested for COVID? You just answer all the questions and walk through, and basically it's very, very, very easy to do and very straightforward. So That's all for that. The key points for today are telehealth is healthcare from the comfort of your home. It's very easy to do. It's very straightforward. It'll walk you through it, and you don't have to go into an office. It's intended to increase accessibility to medical services, and telehealth care includes, but is not limited to, booking appointments, being monitored remotely, or doing a doctor's visit without having to be face to face with your healthcare provider. So with that being said, that's all I have for you guys today. Are there any questions? Let me see. Let me look at the chat.
I have a question.
Oh, hello.
Hi, this is Sandra Bears. I can't get in with my iPad. I'm getting all this information from my cell phone, and I've been trying for quite some time. And it first it came up waiting for the host, but that's all I can get. Maybe we can handle that later. But I'm only getting it on my cell phone, not on my iPad.
Hi, Sandra. This is Mark Rivetta, Education Manager at Byte. Unfortunately, we don't have the ability to help you troubleshoot at this moment to
Mhm.
transfer your access to your iPad from your phone. We are recording this, so we can share a video recording of this, so you can watch it fully on your iPad at a later time, and we can share the slide deck from this presentation also, Sandra. So unfortunately, you're just going to have to continue on the phone, but we will provide you assistance, or at least these resources later.
Okay.
Okay, and I see a question that says this feature can be used with any healthcare provider. What feature are you referring to specifically?
Um, the whole thing that you're talking about, everything you gave us that this tele thing will do. Um, Connecting with
Sometimes the portals don't let you in.
Mm. Well,
I know, like for instance, I have Kaiser, and Kaiser is really up on all this, and they have a direct video, so can I connect my Kaiser? You know, Kaiser has it my doctor wants a virtual. I can go in on Kaiser's website, and they have an automatic thing set up where I just tap it, and they connect to me automatically. So I was wondering if I was on my iPad, will I be able to go through my iPad, or is it necessary? I
yeah,
don't know.
I would think, I mean, I actually, I could look this up. I would think that Kaiser more than likely has an app that you can use, that you can download. I'm actually going to look now.
I can actually answer this, Ms. Mara.
Oh, okay.
Thank you for this question. So most healthcare providers, it doesn't fall to the healthcare provider specifically. It falls to the doctor's office about what service that they use. So some medical doctors will use Cisco. Some medical doctors will use ZocDoc. Some medical doctors will use another service, right, specifically to provide access. The important thing, and we'll talk about this shortly, is that you look for the specific link that they send you. They will always send you instructions specifically to connect to their office, to that doctor. That's the most important thing, right? So you can find information on the websites for Kaiser or Blue Cross, Blue Shield, or things of that nature. But at the end of the day, it's really all about what the doctor's office sends to you that you use to connect.
Okay.
Sure.
Hello?
Yes, sir.
Yes. What about like Washington Hospital Center? They have portals, a patient portal, but sometimes they just don't let you in. You sign up, and you don't get in.
So that might be an IT issue that you'd want to actually talk to them or at least their IT technician about if you're having trouble accessing the portal, or if you're in the portal and it doesn't take you. In some cases, it could be the machine you're on. If you're on an iPad or computer, sometimes there's windows. There's certain windows that are blocked. They think of it as an ad blocker, and so they don't allow you to open up other windows. So that would be best a question that you explore with an IT technician from that respective service.
Okay,
To
and
make
one
sure that,
other
yeah,
thing.
sure.
If you're in a portal with one doctor's office and they don't have all your updated medicine, how do you let them know that they need to update your medicine?
I believe the best way to do that, and this is actually something we're going to go into a little bit later, so we do need to continue, and so we'll field some more questions later in the presentation, but that is something that you would actually do with the doctor's office, their front desk, to talk to them specifically, and that more or less corresponds to that last section that we were going to talk about follow-up, right? What to do after our visits. So we'll explore that more later. So
Okay.
unfortunately, we don't have time for more questions at this moment. We'll be taking more questions shortly. I would like to hand the floor over now to Latika.
Hi, good afternoon, everyone. My name is Latika, and today I'll be talking to you about the pros and cons of telehealth. So today's agenda, we'll be talking about the benefits of telehealth and some of the shortcomings of telehealth as well. So some of the benefits of telehealth, these appointments can save you trips, and especially if you have mobility issues, it saves time and money. You can just do it from the comfort of your home. So it cuts down on commuting, travel in bad weather, time off of work, and need for childcare, because you can do it literally from anywhere with a device that has access to the internet. It also shortens your wait time to see a provider and expands the range of specialists who live further away. So if you need a doctor and they're all the way in, let's say, Baltimore County, you'd be able to do a telehealth appointment with them and not necessarily have to travel all the way to see them. And yeah, so again, the biggest benefit of telehealth is it can be performed anywhere that you have technology and use of the internet. Some of the other benefits, evidence shows that the quality of care is the same for most things that you get done. So like management of long-term chronic disease management, you'll be able to do most of the things from home via telehealth visit. And to Felicia's point, it limits the physical contact with anyone and reduces the exposure of COVID-19 because you won't be in the presence of anyone else outside of your home or wherever you're at during the telehealth visit. And experts say that, we can expect 20 to 30% of care to be delivered digitally from now on. We know that due to COVID, a lot of doctors' offices ramped up their telehealth connectivity and programming to meet the needs of patients. But now, for most of us, it'll be a thing and it'll be here to stay for most doctors, for a lot of doctors. Okay, now we'll talk about some of the shortcomings. So we all know that, meeting in person, a lot of people are better able to communicate what's happening face to face. So that's one of the shortcomings, that you're doing it over a screen. So that might limit the actual feeling that you get talking to a doctor. And it isn't possible to do every type of visit remotely. They're not able to see like certain areas, and it's not as clear over a screen. And some people are worried about the security of health data transmission electronically over the internet. So that might be some people's concerns. And to the insurance point, some of these appointments and services might not be fully covered by your insurance. And so we'll talk about that further in the presentation about what you should do if you notice that you're getting charged for one of these telehealth visits. So the key points to remember, the benefits of telehealth is that you can do it virtually from anywhere, cuts down on your commuting time. It can shorten the wait times to see a provider, and limits the contact with anyone else and reduces the exposure to COVID-19. Evidence shows that the quality of care is the same. So most things you can do over telehealth. And one thing to remember though, it's not possible to do every type of visit remotely, but most things can be done over a telehealth appointment. Does anyone have any questions?
I was just going to say that it seems like it would cut down on white coat syndrome.
I'm not sure what that is. Can you expand?
Oh, okay. White coat syndrome is the thing when you go into the doctor's office, you get all nervous, you sweat a lot, your pressure probably goes up. And I would think that something over tele would cut, would limit that type of reaction when you see a doctor.
That's a great point. Thanks for sharing that.
Mm-hmm.
Any other questions? or observations before we proceed to the next section?
My experience has been that the staff is not sufficiently trained in the technology, because I've given up on telehealth, because once I've set up a password, I always get a message that it's invalid. And I think it's very often the staff is not adequately trained on the technology. So I've just said, have my doctor telephone me, because it's frustrating once you've got a password and then you keep getting a message saying it's invalid.
Ms. Irvin, I completely agree. I think that, you know, as Latika pointed out, right, this is a fairly new service. It's been around for a while, but it's really become more prevalent over the past year. And yes, with the sense of urgency and the need to switch to more telehealth appointments, not all staff receive the proper training. I would suggest, though, that in case that happens again, now that you have an iPad, now that you know you're becoming more proficient with Zoom and other services, that you use a screen sharing option like we are right now, and maybe have one of the staff members who is trained walk you through so they can see exactly online what issue you're experiencing. Because the reality is most offices, as Latika pointed out, this is the way they're gravitating to. So the sooner you can find out what issue you're running into when you're in that portal, the better off. So that's what I would do. See if you can schedule them for a walkthrough on your iPad, on your device.
Yeah, well, it's not a problem with my device. It's the password that they've given me and I've given them, and then it doesn't work when it's time for the appointment.
Right. It's a matter of saying, but to see it is one thing. To hear you talk about it is another thing. So if they're actually able to see it, there may be some issue that they're able to identify on their end and therefore help you. That's why I make that suggestion.
Thank you.
Excuse me, we take these iPads to the doctor's office?
I imagine so. It's your property. So if you wish to take the iPad to, you know, take notes.
What about the internet? What if my internet doesn't carry? Does it go with me? I mean, my internet or
unfortunately,
internet?
it depends on the internet service that you have. So in some cases, let's say that you have a subscription with Verizon, Comcast, AT&T, you might have internet that's connected to your iPad that can go with you. In other cases, your internet connectivity relies on your at-home service, right? And so the moment you go beyond a certain boundary, you will not be able to access it. There are options. For instance, there's, you know, a lot of offices now have free Wi-Fi available. The issue with that, and we are going to touch upon this later, though, is that whenever you're doing anything related to telehealth, medicine, personal information, as we pointed out in our original call, you should be very careful about accessing anything that is private data with a public connection.
Okay, what about like AT&T, my phone, AT&T, it has its own Wi-Fi, right?
Yes, it should, but I can't speak to that specifically, only because I don't know what your plan is, right? Every plan it differs. Some plans may just give you cellular service, some plans may be cellular and Wi-Fi. So I can't really speak to that, unfortunately. We do have to move on to the next section. I'm sorry, Mr. Cross, but we will.
No, my name is Rose.
Oh, Rose. John C. Rose. I'm sorry, Mr. Rose. I apologize. But we will feel free to please next time around, which will be shortly, we'll be able to answer some more of your questions and other questions as they come in. I believe we're getting some more questions in the chat, which I'm happy to answer shortly. But thanks for your patience and thanks for your great questions, everyone. I really, really appreciate it. So for the next section, we're going to be talking about specifically how to use telehealth, right? And what you can expect from telehealth. There's a couple of really key pieces here that we want to make sure that everyone understands rather well. And so let me go first to actually before telehealth. A lot of people think, like I said, of telehealth as it's just the appointment, but there's so much more to it, right? For instance, telehealth appointments, something important to know is that most of them are covered by Medicare. You know, Latika did mention that there are issues sometimes with out-of-pocket costs, but for the most part, straightforward one-on-one doctor's appointments are going to be covered the same that they would be, and you pay the same as you would as a face-to-face appointment, right? Telehealth preparation, of course, you're going to need a device. Could be a computer, could be a pad, could be a smartphone. Personally, I would recommend your iPad or another computer, specifically so you have a greater screen, right? So you can see more of the doctor and the office, and they can see, in a sense, more of you, right? Better quality camera, ideally. Also, to schedule appointments, you may have to call or do it online. As was pointed out by another one of our attendees, in some cases, calling may be the best option because, if you have to go through a patient portal, you can run into trouble. And so it's important that at the very end of the day, you need to schedule that appointment. Do what's most convenient for you is what I recommend. Also, when you do call or you do go online, you're going to want to ask, well, what is the process, right? Typically speaking, they will email you a set of instructions for what that process looks like once you do schedule your appointment. Even so, it's best to at least hear from them directly. What does that process look like and what can you expect? Specifically how that link will be sent. And finally, in some cases, you will have to fill out documents prior to the appointment. Sometimes this can be done online. Sometimes they will mail these to you. So ask about this as well. What documents do you still need to fill out in order to proceed with and prepare for your telehealth appointments? Now, before telehealth, your appointment, though, you definitely want to do a couple things as well, right? One, and I know this seems so straightforward, but it really is so important. I find myself doing this a lot too. Set a reminder. And the reason being, for some reason, I remember in-person appointments better than I do telehealth appointments, virtual appointments, right? I feel that there's something about knowing that you had to go somewhere that says something to your mind. Okay, I need to remember this. But when you just schedule something for online, you say, okay, it's there, it's done. Set a reminder so you don't miss that telehealth appointments. Locate your vital documents, right? Some offices, not all offices, but some offices do ask that you provide your ID and insurance cards, right? As a precursor to the actual appointment. So just make sure you know where those are previously. Complete those documents that I mentioned. In some cases you will have to, sometimes you don't, but it's best that you complete and have those items ready. Take pictures of your trouble areas. And as was pointed out, sometimes you can't see everything very easily using your iPad, using a phone, even with a set computer, right? So you may want to take some pictures of your trouble areas. Maybe something's black and blue that's not so easy to, lift up your leg. Take a picture of it, have that ready, which you'll be able to share with the doctor. Write down important questions. I don't know how many times I've gone to a doctor's office with 5 questions I need to ask, and I only remember one of them. So it's just really helpful if you write down those questions in advance of your appointments. And this is really key as well, right? If you are doing telehealth from home, a lot of us have families, a lot of us have people running around. Make sure that you prepare your family or your friends or whoever might be with you to say, listen, I have an appointment at this time. I'm going to be in this space. I'm going to need quiet. And also make sure that you have good light, because the better lighting that you have, also the more the doctor will be able to see. Finally, and this is vital, right? As Mr. Rose just, spoke to the need for reliable internet connection, make sure you are somewhere that has that reliable internet connection. Specifically, in some cases, some parts of a house or an apartment or wherever you are have better Wi-Fi connection and connectivity than others. So make sure you find one that has really strong connection, because you don't want to have, worst case scenario, have your appointment dropped in the middle of your discussion with your doctor. As far as what to expect during the visit itself, typically speaking, you will receive a hyperlink through an email or a text message, either the day before or an hour before, right? It varies. Different doctor's offices do it differently. So make sure, like I said earlier, you ask when and where or when and how will I receive this link to connect. And one thing that you can do, and we'll provide a link to this after the fact, there's a couple tips, right? There's a lot of great resources online that kind of walk you through this process that say, this is how you should prepare for a telehealth appointment. This is what you will need. And this is just one example that's been provided by WebEx, right? They kind of walk you through what you might want for their platform as well, just to give you some advice. And we will provide a link to this in the email that we send out after this meeting. Something else to consider is you will have the chance to test your settings, right? Sometimes your video doesn't work properly. Sometimes your audio doesn't work properly. But usually you will be placed into a waiting room where you can test those items, right? You will be, before you see a doctor, you'll be there and you'll patiently waiting to see that doctor, and everything will, you'll be able to test those items that you need. Finally, once the doctor arrives, it's go time, right? You're going to be able to still not just see the doctor, talk to the doctor. You can share information with that doctor via the chat. Maybe you want to share that picture that you took. Maybe you want to share a link to something that you've read online. You will be able to do that with the doctor. Just about every single online option for virtual meeting option will provide you that opportunity to talk to the doctor in multiple ways. So I want to also just go through two real examples briefly about telehealth, right? One, we're going to go to a test meeting, and two, we're going to go to the CVS pharmacy, right? Because telehealth isn't necessarily always face-to-face. Telehealth also is these other things that you can take advantage of. So let's go to the WebEx test, right? And this is a service that some doctors' offices do use. And the reason I'm taking us here is because for the most part, most video services, they have overlapping qualities, overlapping feels. So if you know the basic tools, let's say of Zoom, which we use, you will know and recognize the tools in another format, right? So let me just type in my name, and here's my email address, and then I join. And that's typically usually what happens. You can either join from a portal, or you just click on the link and it'll take you exactly where you need to go. So here's the WebEx meeting layout that we're going to right now. And it says that right now I'm muted and my video is off, right? So here I am, I'm in the waiting room. But one thing I can do is, you see here, like I said earlier, you can test things. I can test the speaker and the microphone. So let me just go ahead and I click that, and what comes up, you see I'm speaking and it's capturing you can actually see the volume rising and falling, rising and falling. That means that I'm good. They're going to be able to hear me. As far as my video is concerned, I can't test my video right now because it's being occupied by the Zoom call, right? But you'll have a similar thing up there where you will actually be able to see your video, your face on the screen. Once I'm ready, you see these options down here. I can unmute myself. I can start the video, which I can't do right now because it's occupied, or I can join the meeting. I'm going to join the meeting, and then it'll take me out of the lobby into another area where ideally the doctor will arrive shortly to welcome me and to talk to me, right? And this is what I see. It's just me here waiting for the doctor to appear, right? No one's talking to me yet. But what else do I see here? See, the host is not in the meeting because we aren't meeting with a real doctor. But I also look, I have a menu bar. I have audio and video that I can look to, switch audio, music mode, the camera options. I can change my background if you really want to change your background. There's different views that you can do, right? And you can also unmute yourself. There's lots of different options here, but a lot of these options, the most important thing is that you recognize is that they're very familiar options, right? There's no surprises here. There's chat rooms, there's the video options, lots of different things that you can do. And you can even, in this one though, you can even take notes for yourself. If you don't want to have to go outside to another note-taking option, you can take notes as you're listening to the doctor, right? Which is a really, really neat feature. So note 1, and so on and so forth, right? So this is just meant to give you a nice little introduction to what it might look like in another format, specifically WebEx. And at the end, you just leave the meeting. It's as simple as that. Typically speaking, the doctor will end the meeting for you and you'll be taken back. But in this case, I'm ending the meeting for us. Now, when it comes to the pharmacy, did I click on it? Nope. Excuse me. When it comes to the pharmacy, I chose CVS because for the most part, a lot of us use CVS. I use CVS. Our presenters also use CVS. I checked with them, and I just want to walk you through the CVS sign-in. If you just put in your name and you continue, and there's my password, which you can't see. And once you're in, this is going to be the layout, right? It's very similar to the actual CVS login page, except that it has information about you at the top. Here are prescriptions ready for pickup, prescriptions available for refill, pharmacy text alert. So right here, immediately, it's giving you a lot of the information that you want to see, right? A lot of the things when it comes to your pharmaceuticals, they are here front and center. If you need to find a pharmacy, you can go looking for visit a pharmacy. If there are any sort of messages, like say one of your prescriptions has been fulfilled, it's going to pop up here in the messaging and alerts. At the moment, I don't have any messages. There's no alerts for me, right? But if I did, that's where I would go and I'd be able to read it and click on it like I would an email, right? So I just wanted to go into here, into the CVS pharmacy, simply to show you that pretty much what you do face-to-face with a pharmacist, you can do right here. A nice perk though is that I also get coupons. Look at the COVID-19. Remember, we're talking just about how do you schedule a vaccine. You can do it here also once you log in. You can check out your prescriptions, and then you can come down here and look at the vaccine availability, or you can go shopping for other CVS products. So there's a lot of different things you can do in your CVS pharmacy portal, but the most important one being, of course, is the prescriptions. So one moment while I get back to the main screen. So I know that was a lot of information, but a couple of key takeaways I want to share before we move on to our questions is that make sure that you prepare before a telehealth appointment. The more you prepare, the smoother your appointment is going to be, just like any appointments. Also, make sure that you don't connect to a telehealth appointment using a public device or network, right? You don't want to go into a DC Public Library and use one of their computers because you don't know if you can trust them. You don't want to be at a Starbucks and connect to a telehealth appointment because you'll be on a public network. It's the safest thing to do to protect yourself and to protect your information, and not use those options when you do a telehealth appointment. Another thing is that for telehealth services, please, please, please be careful with your selection. In some cases, specifically around the pharmacy, right? You have prescriptions that you are using at CVS. Make sure which option you've selected. Are you expecting to have it delivered? Well, then make sure you select the delivery option. Do you want pickup? Make sure you select the pickup option. It's always good just to double check what your telehealth option that you've selected, so you don't have to go back. And that being said, before we move on to the next section, which is what to do after a telehealth visit, I'm open for questions. Let's see.
I sent a note to go back to the previous links. I wanted to screenshot them.
Oh, sure. Well, I can also share this slide deck with you after, but yes, if you'd like to screenshot, let me go back.
The one before that one where you have the two links.
Oh, I'm sorry. Yes, there you go.
Okay, thanks.
You're welcome. Other questions?
Do you have to download apps, CVS apps? How do you connect if you have not, this is your first time?
Yes. There is a CVS app you can download. If this is your first time, the easiest way to get there, and I'll just take us out of the screen for a moment. The easiest way to get there is specifically if you go into, if you're just looking for CVS, you don't know it offhand, usually it's just cvs.com, right? But if you just want to go and you say, okay, I'm here, I am at Google, here's the search bar, and you type in CVS, it's the first thing that pops up, and you can click on CVS. And also I want to point out that rather than having to navigate the CVS website itself, you can go down here to the options. If you just want to shop, you can go to shop. If you just want the pharmacy, you can go to pharmacy. If you're looking for a vaccine, go to vaccine. But if you want to go into the portal, you can simply skip the line and go to sign in. Those all pop up as well. So that would be the easiest way. Instead of downloading the app, just go online, go to the CVS website, or just Google it, and then you can go directly where you want to go.
Oh, okay, thank you.
You're welcome. Other questions?
That WebEx. Yeah, is that that's used only with the doctors?
Some doctors.
Huh?
Some doctors, and that's important, right? Different doctors use different services, but the main point I want to emphasize is that even if they're using different services, they all pretty standard have the same.
How long does it take you to check out one day?
So that means that if I decide,
Yeah.
what's the difference between using that? Excuse me. What's the difference in using that?
Oops. Sorry, it looks like we lost you.
Okay, you ready?
Yes, sorry. What's the difference between using that?
Okay. Yeah, what's the difference between using that and when you make an appointment with the doctor, they automatically set up some type of, communications through telecommunications anyway. So at what point would I want to use the WebNext?
It's not a matter of what point do you want to use the WebEx. The reason I took us to WebEx is because it's one of the few free ones that we can actually demonstrate with online. And it was just to make sure that you see that if you know how to use a chat tool, which you do here, if you know how to use the mute button, if you know how to use the video on off button, right? All of these different services, whether it be WebEx or Zoom or Connect Me Now or whatever they are, that they all have the same tools. That's all I really wanted to demonstrate.
Oh, okay. Thank you.
Sure. Let me go to the chat. I'm going to see, I believe there's some.
Wait a minute. I have a question. What about us that are technology challenged? And when you be showing those things, you go so fast that we don't get the gist of it.
Sure. So a couple things, right? First and foremost, we will be sending out a link to the video of this presentation within a couple of days. We will also be sending out a copy of all of the screens, right? So all of this entire slide deck, you will have access to. So you can just go and read it through the different points at your own, pace. So you'll have both a copy of the video and the slides.
Okay.
Sure.
Well, I know
and we have numbers we can call. We have questions, right?
Absolutely. Yes, that too. I'm just going to read a couple questions here before we move on in the chat room. When it's time for your appointment, do you initiate the visit or wait for the office to notify you? Suppose you're in the waiting room for an inordinate amount of time. That's an excellent question. So having done multiple appointments this past year, I can say that I fortunately didn't have to wait more than 10 minutes for any of those appointments. I don't consider that to be a very long time. And so I just waited and waited. And there's usually a message that says the doctor is wrapping up another appointment. Please be patient. And I saw that message consistently. And, within 10 minutes, I met with the doctor. I would say whatever your threshold for waiting is, that should determine whether or not you should then reach out to the office. Because some, having gone to face-to-face in-person appointments, I've waited as much as 30, 40 minutes before I see a doctor. Sometimes they're running really behind. So it just depends on what you are used to. But I would say 10, 15 minutes is not a long time to wait. And if it goes longer than that, then maybe you should talk to your doctor. Let me see another question. Okay. Most hospitals have a visitor internet service. This is correct. That's true. You can definitely, when you're in hospital lobby, waiting room, you usually have a public network. But once again, you shouldn't do private things on public networks or on public machines. I've been notified from the iPad service desk that everyone has free internet 3G wireless data through June 2022 on your iPads. That's fantastic. So that actually speaks to Mr. Rose's question about traveling with the iPad. You will have connectivity wherever you go. So long as you're not in a bunker, you should be able to reach and connect to the internet.
So once we lose all this data we have, what happens to our iPad? We have to rely on what we have at home?
Well, ideally, hopefully, so June 2022, right? We are 1 year away from that. We're in May 2021. Ideally, by June 2022, you will be able to access other services to connect to the internet, other providers, right? And there are discounted plans. If money is an issue for anyone on the line, there are discounted plans that we can speak to later, right? Like Comcast Internet Essentials or a couple of other providers have other programs that we can talk to.
Did this take over what we already have?
Did what take over?
Did you all take over any data services we already have? I mean, once you leave, will we still be left with what we had originally? If we had any other devices in our house?
I don't know actually. I don't know what the arrangement is with the Department of Aging and Community Living. So you'd have to talk to the program manager about what will happen at that point.
Okay, thank you.
Sure. And it seems that we have one more question. Even though we have free data, I use my internet service, and that's perfectly okay, right? You can choose how you want to connect. If you have a much faster speed at home, go for it. I highly recommend that. So that being said, we're going to move on to our final section, and then we're going to talk about some more questions. So I'd like to hand the floor over to Dina.
Thank you, Mark. Good afternoon, everyone. My name is Dina, and I'm glad to be here today. We will be talking about what to do after a telehealth visit, and we'll also look about other important information about telehealth. So after your telehealth visit, if any testing is recommended, the provider will arrange for it. What you have to do is to make sure that you know where the testing will occur. So the testing can occur at a nearby lab or clinic, or sometimes it can also happen from your own home. So if there are other information or you need, the provider will also give you that. Next, please. Also, if you need follow-up information, call your provider's office. If you need to schedule another telehealth or office visit, your health provider can also help you with that. Finally, make sure that everything have been taken care after your visit. You can ask your provider if you have bills to pay, because you don't need to have trouble for your next visit. So we are going to see other important information about telehealth. Sometimes language and disabilities can become a barrier to the medical services that we are entitled to. So if English is not your first language, just know that an interpreter can join and help you talk with the provider. So ask your provider how to connect with an interpreter. Also, if you have a vision, hearing, or speech disability, you are entitled to aids and services such as TRS or telecommunications relay services, which can be reached by calling 711, or also video relays services, video remote interpreting. This is where you can find like sign language interpreter. So our key points today, we have seen that if you need follow-up information, just call your provider's office. If English is not your first language, an interpreter can join and help you talk with the provider. If you have a vision, hearing, or speech disability, ask your provider how you can have access to all the aids and services that you are entitled to. Thank you so much for your time and attention. If you have any question, I'm here. Thank you.
Thank you, Dina. I appreciate that. So it looks like we are at 2 o'clock. We have approximately 15 minutes left. I know that we've gone over a lot of information, and we did plan on actually on, in addition, not just to, visiting CVS, which we did, but taking you to DC Health Link with Latika. But it looks like we're short on time for that. I do want to point out that just really quick that DC Health Link is actually the place that you would go to look for health insurance in DC predominantly. And it's a pretty straightforward process. This is the website that you can go. For most of us, we're going to be going to the individual and family section to get started. And once there, you could fill out their either apply for Medicaid or shop and enroll. But I just want to make sure that everyone, we can't walk you through the whole process like we planned with Latika, but I just wanted to show you the website. It's DC Health Link, and they do have a phone number that you can use right here, right? And as Dina just spoke to about the, if you have a different machine to read 711, they have that access number as well. That being said, we are at the tail end of our time allotments. We would like to hear more from you. I'm sure there's still a couple of questions that we haven't answered. And so we're happy to hear from you now. Any remaining questions about any of the information that we discussed?
Yes. How do you get a dentist for an orthodontist?
An orthodontist, it depends on your coverage. Different plans have different availability. So for instance, I believe Kaiser Permanente, it's kind of all a bundle. It's all wrapped up into one, and you have access to different doctors, specialists, including dentists. For other programs, for Blue Cross Blue Shield, it's a little bit more diffuse and you have to go looking for them. So one of the things that you could do is you could look for a certain specific person who might be on your plan. But to do that, most of the time, you have to go to the healthcare provider. So depending on the insurance you're using, if it's Medicaid, if it's Blue Cross Blue Shield, if it's Kaiser, whoever it is, you will have to go to that specific provider to see who's in network, who is a dentist, who is a doctor you can use. And usually they say, what's your zip code, and ask you questions like that. So that's where you would have to go for
I
this.
can do all this on the iPad.
Yes, as long as you, so let me give you an example. So let's go to, once again, the wonderful world of Google. And if I type in Blue Cross Dentist near me, that pops up. So here we have a couple of options, right? One option you can use stock. Another option, so that would probably be the easiest option, right? To say, here, what do I need? Where do I live? That's a really easier, and what's my plan, right? And then it'll look specifically at the plans, the carriers, so let's say I have Medicaid, right? And then I'll say DC dental is what I would be looking under. And then near me, let's say I live near Byte back, right? And that's all I give them.
Okay.
Then it's going to pull up different information, different doctors who cater to Medicaid in the DC area near that zip code.
Okay.
Other questions?
Can DC Health help you find the specialist? DC Health Link?
DC Health Link, it's possible. DC Health Link is more for health insurance itself, though. I feel that if you were to go to their website and you were to give them a call, they would be willing to help you if you were to call that customer service number. But when it comes to specific, specialists that you might want to see, the best place to go is to go through the insurance provider that you're using, right?
Okay.
Because yeah, they can give you more advice about health insurance than they can about specific providers. Or excuse me, specific doctors.
Thank you.
Sure. Other questions? Don't be shy. We still got a couple minutes left, and we want to make sure that we answer as many questions as possible before we go.
Well, I have a question that's a little off topic. I sent a chat, but I don't know if you can see it.
What was the question?
About something that keeps popping up on my screen that says iPad not backed up. This iPad hasn't been backed up.
I get the same message, and I was trying to find out what's going on.
So there's actually, I believe there's an iPad service number, not specifically with Apple, but with DACL, Department of Aging and Community Living, that sponsors these programs. They have someone who can assist with the iPad. I don't have that number at my leisure, unfortunately, but when we send out our email to connect with everyone, we can share that with you. One thing specifically, though, I would like to ask, so we've collected the names of just about everyone who's attended, but if your name is listed as me, if you are showing that you are also Mark Rivera on your screen, please type your name into the chat room right now. And then that way we know that you attended and we know to reach out to you as well. In the meantime, are there other questions that we can help you address?
I think I registered earlier, so I really didn't know how to type my name in because I don't have a webcam.
That is quite all right. Just as long as you can type your name into the chat, or if you tell me, if you don't mind telling everyone who you are right now. What is your name, ma'am?
Patricia Daniels.
Patricia Daniels, thank you so much for sharing your name. We'll make sure to add you to the contact list.
If I already asked a question and you have my name, do I have to put my name in again?
No.
Perfect. Okay.
Yeah.
All right. Thank you.
Sure. Are there other questions before we go on to enjoy this increasingly hot day?
When will the next session be from your group?
The next session from this group will be the second to last Thursday in June. I don't know what that specific date is, but our sessions, Byte back sessions about accessing services and resources in the DC area, those are always going to be the second to last Thursday of every month, right? And I believe our next topic is going to I think it's actually going to be focused on accessing DC specific services, not just healthcare, but we're going to be talking about the DMV. We're going to be talking about the Health and Human Resources Office. We're going to be talking about various offices, how to get to them and how to use them. So be on the lookout for our next invitation.
Thank you. We'll automatically get it, get the email. I didn't seem to get this one for some reason. That's why I had to ask.
I'm sorry. Yeah, I hope so. I mean, we are writing down everyone's names specifically so we can email you later. And so we can include that information as well.
Thank you.
You're welcome.
My name is Carol, and all these messages are in my chat box. I mean,
yes, there are quite a few messages, a couple of questions that have been answered, a couple of comments. How can I help you, Carolyn?
well, I was wondering, how do I get rid of that? I mean, next time I sign on, will they still be there?
No. Every time you're in a meeting, the chat room, it populates with those messages. And once you leave that meeting and you go into another meeting, that chat room will disappear and all those messages will disappear.
Oh, okay, good. Because I've never seen that happen before with the other session.
Oh, no worries. Well, you know, maybe there's just not a lot of chat going on that.
They didn't have any questions.
Well, if are there more questions here? We're happy to keep talking. You still have us for at least another 6 minutes, unless there's no more questions.
So you will send us a recording of this session?
Yes. So after this, we have to, of course, you know, upload it to uploaded to the cloud, create a unique web address for it, but that will happen. So in the follow-up email, will receive a link to the video. You'll receive a link to a survey about this presentation. You'll receive the slide deck, and you'll also receive information about our next presentation. Yes.
Okay.
Well, thank you.
Okay, very quickly, I get that notification too that my iPad is not backed up. Now, what are they saying? What does backed up mean?
Typically means that your files haven't been saved in another location. So maybe you're saving information on your computer and it is saved, but when they say backed up, it usually is referring to an alternative storage facility like the cloud, right? So maybe you have items saved on your iPad, but you haven't backed them up to save to the cloud in case something happens to your iPad.
Sir, do we
See,
have
and
a
would I
session?
would go to settings to do that, right? Go to
Yes,
settings.
if you are connected to the cloud, if you have an Apple account that to save those items in another place.
Yes.
And I believe Mr. Rose also just asked a question.
Yes. Did we have a session where they I think they signed us up for the Apple Cloud? So that means the session is backed up on my Apple Cloud on my iPad.
I don't know about that. I don't know if there's any sort of session. We aren't hosting any sessions about using the cloud specifically. So I'll have to talk to my colleagues after this
Yeah, the
about.
first time I was on this, they told us that we would be signing into the cloud, the Apple Cloud or something.
There are different sessions on that. You have to look up the different iPad. They have every week they have iPad training. You could ask those questions there. If you look on your account, look on your calendar on your iPad, and it gives you all the trainings. It's over and over every week.
I have
all
a
that
calendar
stuff.
on my iPad.
Yes, you do. Go to that. Can I one other thing? You showed the DC links. You also showed an actual link. But other than that, I just got the page that you came in on. Do I just go on dc.links or something to get that, or can you put up that link again you had for
Which link are you referring to? DC Health link?
Yeah, that's right, DC Health link. Yeah. Did you have a special link I just go on, or do I just
if you type up here DC
I can't
Health
settings.
DCHealthlink.com, it will take you straight there. It'll take you to the landing page though. DCHealthlink.com. That's the landing page that'll take you to.
DC, okay.
Yes, and Mr. Rose, I'm sorry that we can't help you with your iPad right now at the moment, but as was mentioned, there are trainings on a weekly basis that you can attend.
Okay.
Ask that question
but I just can't find settings.
It is a question. It should be an item that looks like this.
Okay.
And
the cloud.
Give me 1 second so I can find you an image.
Your screen on your home page.
Yeah, it should be on the home page. And that's what you're looking for right there. That symbol.
Oh, what I just hit?
That's what you hit, and that takes you to settings. Well, I think that's it. That's all that we have time for today. I want to say thank you to my co-presenters. Thank you, Felicia. Thank you, Dina. Thank you, Latika. You all did a wonderful job. And I also like to say thank you to all of you for attending today. You had a lot of great questions, a lot of great inputs, and also a lot of great suggestions for your fellow attendees in some cases. So I really appreciate that. We look forward to seeing many of you again in the coming month. But in the meantime, please be on the lookout for an email from us with all the information that I mentioned. So thanks again. Have a great day, everyone.
Thank you.
Thank you, Mark.
Thank you.
Bye.
Bye-bye.
Thank
Take care, everyone.
you.